So now the mob and the media, their coronavirus coverage is more dishonest than ever tonight as they continue to smear Florida Governor DeSantis while spinning for failed New York Governor Andrew Cuomo. Remember, all during the protests, they barely talked about COVID-19. We had no social distancing. You had a lot of people without masks. And despite new data showing that the New York dopey governor, like the New Jersey, Pennsylvania, and Michigan dopey governors, in New York, they literally put 6,300 COVID-19 positive patients into nursing homes during the height of the pandemic. It was an executive order on March the 25th. How dumb can you be, putting the most vulnerable at even more risk and everybody in the long-term care facilities at risk, right at the epicenter of this outbreak? Remember, Cuomo ignored federal guidance to begin with. He forced nursing homes to take these COVID-positive patients, even though the facilities, they were screaming at the governor, we're not prepared to handle these patients and this influx. And by the way, he barely used the Navy hospital ship that the president sent and the president manned, the thousands of other beds that the president built and also manned and also converted to COVID-19 capability. And it was President Trump that provided all the ventilators and all the PPE. It was the Trump administration. Yep, they sent it all to New York, Governor Cuomo, and New Jersey and everywhere else that needed it, because Cuomo and de Blasio, they never addressed the shortages that they were both warned about. It was Cuomo's own task force, healthcare task force, in November of 2015. They said you're going to need an extra 15,783 ventilators at peak week if there's a pandemic. Buy them. He didn't buy any. It was never been a bigger failure to prepare, bigger response failure to any healthcare crisis than Cuomo and de Blasio and Murphy and Wolf and, of course, Whitmer. Now, we need to, by the way, personally, I got to get out of this idiotic state. They're robbing me blind, and they're failing to keep New Yorkers safe now. Look at the data. New York has a disturbing 166 deaths per 100,000 people, and only New Jersey is higher. It's so sad, so preventable in a lot of cases, and tragic, because it did not have to be this way. Cuomo, Wolf, Murphy, Whitmer, they didn't have to put sick patients in nursing homes, long-term care facilities. Cuomo didn't have to ignore federal guidance and top health officials. He and de Blasio could have responded sooner instead of downplaying the virus in February or March. Oh, go out on the town, de Blasio was saying. Cuomo saying, we're New Yorkers, we have this handled. They weren't prepared for anything. They could have addressed PPE shortages, and they could have had a targeted approach to protect those most at risk. But they didn't. They played petty politics, and they said it was the nursing home's responsibility for PPE. Then Cuomo said, well, people are going to die anyway, and all while New York City became the epicenter of the virus. A complete failure of leadership, epic fail, a complete dereliction of duty. Thousands and thousands died needlessly because of their decisions. But the mob, the media, they would rather distract you and pretend like none of that ever happened, focusing on Florida that happened to do one of the best jobs, and focusing on spreading more propaganda, misinformation, more smears, more slander, more conspiracy theories. All right, let's go to the facts in the state of Florida. There's only 17 deaths per 100,000 people, and recently the age in terms of new cases of COVID-19 are on average 21. More testing, yep, means more positive results. We knew that would happen. The one thing the so-called experts actually got right when they got so much wrong is that the elderly, those with underlying conditions, those with compromised immune systems, they were the vast majority that died. Well, they were protected in Florida. The populations, New York, New Jersey, and Michigan, they didn't protect the vulnerable, the elderly. The case fatality rate in Florida is 1.8%. Much lower than most other states. Florida actually took dramatic steps very early to protect the elderly community, nursing homes, long-term care facilities, the villages. They deployed mobile testing teams to expand testing in these facilities. They issued a directive requiring staff that work with residents in nursing homes to wear a mask. And most importantly, Governor DeSantis, he didn't send coronavirus patients back to the nursing homes early on in the epidemic. That was the dumbest decision. Frankly, the uptick in cases that we're now seeing in Florida is nothing compared to the deaths that were caused by Cuomo and Murphy and Wolf and Whitmer's nursing home scandals. And by the way, now is the good news. Coronavirus deaths, in spite of what the mob and the media is telling you, these are just the facts. They continue to plummet nationwide. Now, that doesn't excuse what these governors did. In New York, for example, Cuomo, along with all these other governors, they presided over a massive nursing home catastrophe. But at the same time, these governors also were endorsing mass protests, glorifying destruction, and still deflecting any and all blame. When everything else fails, you blame people, you say they're going to die anyway, and then blame Trump. And while other Democrats, like the L.A. mayor, Garcetti, is finally admitting protests, yeah, that led to an increase in cases. The fact is, Cuomo, these other Democratic governors, they have done irreparable harm to their states and their cities. And innocent people died because of their stupidity. In New York City, at least 1 million jobs are lost. Look at this. The New York Times is pointing out unemployment. New York City is 18.3% in the month of May. That's the highest in 44 years. Why? Many New York City residents are fleeing the city. By the way, I would argue a vast majority are probably not coming back, ever. And who can blame them? The city's crumbling. Crime is spiking, and by the way, it's as though city leaders can't be bothered to even care. And as the Times reports, quote, what was intended as a pause has dragged on so long that for many workers, furloughs are now turning into permanent job losses. And meanwhile, Governor DeSantis in Florida, well, he's moving ahead on practical, precautious, productive plans to safely reopen the state. None are going to be perfect. We're still dealing with unknown factors on everything. We don't have all the answers. But one thing we do know is protect the elderly. This includes planning for reopening schools in August. Here to explain all of this, Florida Governor Ron DeSantis. All right. So I keep reading the Florida. Now, we do have a dramatic increase in cases in Florida. Okay. But it's happening among younger people. Give us the percentages. Tell us what's going on in the ground. Tell us what the death rate is. Tell us about the hospitalizations. And tell us what Florida's doing about it.
Well, we have no doubt seen a major increase in cases. The median age of our new cases was in the 50s about a month and a half ago. Now that's dropped into the 30s. We've had days where the median age was 33. And obviously that's important, Sean, as you know. I mean, because people who are healthy and under 40, you know, the death rate on this thing is very close to zero. So that's significant. Now, we are prepared for this. Now, we are seeing, particularly in places like Miami, you're seeing increased traffic in the hospitals. But it's interesting, I was down there today, and they said that they're actually seeing fewer hospitalizations from people in nursing homes, which is obviously a good sign because that's where the #1 risk of mortality is. And what we've done since the March and April to protect the seniors in long-term care facilities is, yes, we didn't let the hospitals discharge the COVID positive patients back to nursing homes, but now we're saying if someone tests positive in a nursing home, you have a responsibility to transfer them to a place they can safely be isolated. So we've established across the state of Florida 12 COVID-only nursing homes where a resident can safely be transferred so they don't infect the people in their normal long-term care facility. They can be cared for, and that is going to really reduce outbreaks in long-term care facilities, which is very important.
Let's go through the numbers in Florida. Let's start by new cases by age. Now, this is surprising to me. Most cases, the age with most cases are people 21? Explain that, because that had not been that had not previously happened.
Yeah, so of all the ages, the age with the most cases now in Florida is 21. And I think a couple things have happened. One is there is no doubt more transmission going on in the community, particularly amongst people in their 20s and 30s. That's being picked up with the cases from it, and the increasing positivity.
Correct. Let's go to the next chart.
Exactly.
The case fatality rate by state. Okay, if you look at Connecticut, New Jersey, Michigan, and New York, it's very high. In your state, it's 1.8%. That still holds even with these new cases that we're seeing pop up in Florida?
That's right, and I think that's a testament to shielding the elderly from infections, particularly the nursing home residents. The fact of the matter is, if a case occurs in someone in their 20s, you have radically different fatality prospects than if it's someone who's in a long-term care facility in their 80s. So we've worked hard to really shield off the folks who are the most vulnerable. So I think that's why, we have a much lower case fatality rate.
All right, now let's go to the deaths reported by day. And this is up to, I believe, the beginning of July. Per 1 million population, Florida versus New York, I mean, there's a flattened line here. And I look at it and I'm saying, okay, I'm reading and hearing the media freaking out. They didn't freak out during the protests. They only started being concerned about COVID when the president was doing a rally. So these younger people are not dying from this, but younger people are contracting the virus because you're doing more testing. Is that correct, sir?
Well, no, we're definitely doing more testing, but obviously, Sean, we want to make sure that those infections are not spreading to the vulnerable, and that's really the key, and that's what we're working to do every day to protect our vulnerable citizens.
Are you still doing what you did in the beginning, which is go into these nursing homes long-term?
Absolutely. Absolutely, and now we're testing every staff member every 2 weeks, and that's almost 200,000 people that work at over 4,000 facilities in the state of Florida.
Lastly, you have 12 COVID-dedicated nursing facilities in Florida alone. Tell me what that's about, real quick.
It's a safe place for if someone tests positive, they can be isolated in these facilities so that it doesn't spread into the rest of the nursing home residents. It's a way to reduce and prevent outbreaks among our very most vulnerable citizens.
So in other words, while younger people are getting it, they're not dying from it, and you're also protecting the elderly. Is that a fact, sir?
We are protecting the elderly. We do it every day. We got more work to do, but that's our goal.
All right, Governor, thank you for being with us.